A neurologist is a medical professional who specializes in conditions that affect the brain, spine, and nervous system. That can include things like dizziness, pins and needles, cognitive changes, and of course, chronic pain disorders like migraine. We look at patterns, mental status such as cognition, symptoms, test results, and we work collaboratively with the patient to figure out what's going on and to set up an effective treatment plan. We really use that time to get to know the patient as a whole person. If able, we also like to hear from friends, family, and caregivers because everyone brings a valuable experience to the table. We talk through symptoms, medical history, any prior diagnoses or treatment, and just as importantly, how these symptoms are impacting someone's quality of life. We also conduct a virtual neurology assessment, which allows us to physically evaluate what's going on. It's not rushed. We want patients to feel that they're truly being heard and that their concerns are valid. A virtual neuro exam focuses on observation and interaction. We might ask patients to complete standardized cognitive assessments, perform simple movements such as standing or walking in a line, to describe their sensations to us or to respond to prompts that help us to evaluate things like their coordination, their speech, memory, and strength. These evaluations are approved by the American Academy of Neurology and are very thorough. We are trained to pick up on small, subtle signs that help us to determine what's going on neurologically, and this exam is an important component of that. We create a care plan with the patient, not just for them. That might include recommendations for lifestyle changes, medications, follow up testing, or referrals. We also work with our support staff, our care concierge, and our coaching team at Neura to provide ongoing support. The plan is always personalized and it evolves over time as we learn more about the patient and their needs. I think the most important thing to know is that you don't have to wait until things are bad enough to seek support. Neurologic symptoms can be confusing or easy to dismiss, especially when they come and go. But starting care early can make a big difference, not just in how you feel, but in how well we can treat and manage what's going on. Whether you're dealing with something new, something ongoing, or you're just not sure where to start, we're here to help to make sense of it all. We don't need you to have it all figured out before reaching out. That's what we're here for, every step of the way.